Hey guys, this is Dr. Jordan Adrian with Limitless Concierge Physical Therapy based in Denver, Colorado. And I'm back again today to talk about one of the other most common questions we get asked as physical therapists. And this is, why do I have pain before I exercise? And then I get into moving and doing my exercise or my sport. After a few minutes, that pain starts to go away. But then towards the end of my participation, in that sport or exercise, or even afterwards, that pain starts to return, and maybe it lingers for a couple hours or even a day or so afterwards. Um, a lot of times in this case, it can be due to a tendon type injury. So most frequently something related to a tendonitis, which is some irritation or some inflammation around the tendon, which is what attaches the muscle to the bone and helps to produce movement. So when you're just starting off, you're not getting a ton of blood flow to that area, and tendons typically don't get a ton of blood flow to begin with. You're not able to withstand that amount of load, and there's some irritation around that tendon, and so it's painful. But as you start to get moving, you start to get some more blood circulating. That's kind of blunts a little bit of that pain response, and that pain starts to subside. However, as you continue to go and exercise or play your sport, that amount of stress that you're putting down into that area can start to catch up with you, and that pain response can start to return. It can take a little while, like I said, sometimes to calm down afterwards. And our goal with physical therapy is to figure out how much stress you're able to put down and through that area, how much you're able to participate in your current activities. And I typically don't tell people to stop participation 100%. We still want to stay active to some level, but we need to make sure that we're finding a balance between doing enough and not overdoing things in order to allow that tendonitis to return and that tendon to return back into a healthy state.